For this demonstration, we have selected the Acapella Choice and Duet. All models operate much the same way, but the Choice and the Duet are likely to be prescribed for patients with chronic respiratory conditions and other patients who will continue PEP therapy after leaving the hospital. The device is tapered at one end. The mouthpiece, which is attached to the tapered end, is placed in your mouth. Alternatively, you may be instructed to fit this end with a mask, which will cover your mouth and nose. The large end is fitted with this expiratory resistance frequency adjustment dial, which rotates. Turning the dial allows you to adjust the vibrations and resistance, fine-tuning the device to the particular characteristics of your lungs to ensure that maximal therapeutic results can be achieved. The setting you select should be determined by your healthcare provider, since it can affect the results of the therapy. Here are the steps used in performing vibratory PEP therapy with Acapella. Wash your hands. Ensure that the adjustment dial is set as recommended by your healthcare provider. Place the mouthpiece lightly in your mouth. Your healthcare provider may recommend the use of a nose clip if necessary. If you are using a mask, apply the mask tightly but comfortably over your nose and mouth. Take a deep breath, larger than normal, but not filling your lungs to capacity. Hold your breath for 2 to 3 seconds. Then, while maintaining a tight seal on the mouthpiece, exhale actively, but not forcefully, through the device. Exhalation should last approximately 3 to 4 seconds. Then, inhale through the mouthpiece and prepare for your next exhalation. Perform 10 to 20 breaths, as recommended by your healthcare provider. Remove the mouthpiece or mask and perform 2 to 3 huff coughs to raise secretions. Huff coughing is performed by forcefully exhaling through an open upper airway, after taking in a large breath and holding it. Follow these steps. Take in a slow, deep breath. Hold the breath for a count of 3 seconds. Exhale in a series of short, quick forced exhalations, making sure that the airway in your throat is open. This can be done by softly saying or whispering the word huff as you do these exhalations. Repeat the huff cough procedure 2 more times for a total of 3 huff coughs. Repeat the sequence of 10 to 20 vibratory PEP breaths and 2 to 3 huff coughs. Your healthcare provider may prescribe the use of a small volume nebulizer with the Acapella to help enhance the inhalation of aerosolized medication, such as bronchodilators. If so, follow these steps to prepare the device for a therapy session. Set up the small volume nebulizer without the mouthpiece per manufacturer's directions or per hospital protocol. Instill medication into the nebulizer cup. The medication nebulizer can be placed between the Acapella and the mouthpiece or mask, or on the back end of the Acapella Choice, Acapella Green or Acapella Blue, depending on clinical choice. For placement between the Acapella and mouthpiece or mask, with the air or oxygen source turned off, connect the nebulizer with tubing and T-piece to the Acapella. Attach the opposite end of the T-piece to the mouthpiece or mask. Adjust flow rate or turn power on to nebulizer compressor and begin therapy. For placement on the back end of the Acapella, with the air or oxygen source turned off, assemble the nebulizer and T-piece in the same fashion and attach to the back end of the Acapella. A 6-inch section of corrugated tubing can be attached to the open end of the T-piece to conserve some of the aerosolized medication during use. To ensure maximum benefit from the Acapella vibratory PEP therapy system, carefully follow the care plan provided by the clinician. Be certain to read and understand the instructions for use accompanying the device.